Um, so we're so we're going to chat a little bit about what it could look like, integrating family systems work into individual CBTP practice. So we're going to chat about that for a few minutes this morning. So overall, we really want to share the objectives is ensuring that, the rationale for incorporating family systems into individual CBT sessions is understood. Also develop an understanding for a proposal that we have of doing this CBT and family systems curriculum so that, people have some guidance and how to do this kind of work. And then we're going to look at one sample technique from a CBTP provider's perspective with integrating care or with integrating family work. So defining family, I think, is the most important place to start. And so, people have all different ideas when they think about the word family and what comes to mind. And so when we use the word family within this context, we really mean a very broad and inclusive definition. It could be a blood relative, could be a significant other, a neighbor, a friend. It's anybody who really plays a meaningful and significant role in that individual participant's life. So they may live with the person, they may have some kind of influence or impact over that person's life. They may care for the person in times of need, and they generally just care about the person, the individual living with the diagnosis. So family systems work. Why you've heard me talk time and time again about the important role that family systems play. And that holds true for individual clients and individual participants as well, not just when you're doing formal family systems work, because family systems really do want and need the support from clinicians. When we are working one-on-one with someone and then they go home to an environment that either we don't have a lot of information about, we don't know that perspective in the home environment about the work that's being done. They don't understand the work that we're doing with the individual. So whenever possible, it's really nice to ensure that the people that are important players in that individual's life understand what's happening in the therapy room so that they can be supportive, or they can reinforce the skills. So, since 1994, when, United States guidelines came out about schizophrenia care, and every iteration since and across, guidelines now, globally, that always is consistent that family interventions are to be offered to individuals living with schizophrenia and psychosis. There's tons of evidence out there talking about the use of family systems work, and the benefits. You see improved outcomes, not just for the participant, but for family systems as a whole. So, but the key is that those family systems have to be informed and they have to be appropriately supportive. And that's the space where we can do a lot of good work. Unfortunately, right now, services for family systems, especially in any kind of formal way, are pretty minimal. Clinicians who are providing one-to-one treatment, especially with adult clients, have very limited contact with family systems. And as a result, unsurprisingly, those family systems tend to be pretty dissatisfied with mental health services. Only about 30% receive basic information about what's going on with their loved one. And, of that 8% attend a support or educational group that's designed for families. So that's a really, really small proportion of what I would say is one population, those living with psychosis, that really need that support from all angles the most when compared to some other disorders. So a family system is really a network. It has bidirectional impact and influence over one another. What impacts one person in that system impacts the rest of the system and vice versa. It's always complex. They are interconnected aspects of the system. That's how we know that they have impact over one another. Everybody within that system has a role to play and a function to serve. And sometimes, especially when you're thinking about early psychosis, those roles shift and those functions shift. And that can be one of the most difficult things that family members and other loved ones and natural supports really experience. Sometimes you'll see that there are subgroups or little coalitions, so you have 5 people in the family and you'll see these 2 kind of hang together and these 3 hang together, or 2 and 2, and then one's kind of out on their own. And so really understanding that system and the dynamics that play within that system can go a long way in our one-on-one work with a client. And family systems are ever evolving. That's the one thing, is that we never stay stagnant or dynamic in this way. So go ahead. So when we talk about taking a systems approach to care, it's really conceptualizing your work, and setting that framework from, this is the individual with whom I'm working. However, I understand that there's a system around them. So how do I think about ways to include that system, ways to talk about the individual to include that system? And so it helps us to shift from sort of our training, which is very much client centric. Is the most common term, but really shifting to a more systemic approach. Um, this means that we have to learn how to skillfully discuss with the individual what it might look like to involve people, or what tell me more about those relationships, tell me more about the belief system of the family system, and then actively on an ongoing basis continuing to have those discussions and or pulling in members of the family system whenever possible. So being planful, strategic, and skillful in how we engage them. And that is what we're hoping this newly developed curriculum can do for those who are coming from a CBTP individual framework, but who recognize the importance of engaging that family system and understanding that family system. So that's what we're going to be talking about today. And I'm going to hand it over to Brian to talk more about our proposed curriculum of CBTP and family system intervention.
Thank you so much, Danelle. So our response to the low uptake of family intervention work is to create a curriculum that we're piloting at a local agency, and we call it CBTP plus FSI. And really the idea behind it is that we're taking people who are trained to do individual CBTP work and just adding a set of skills related to family work. What we want you to do is think about family work as an expansion or an extension of skills that you already use with individuals who have psychosis. It's not a new form of treatment. You're just applying what you know in a different way to a larger group of people. We hope that in training people to work with families, that you will become more confident in working with them. One thing that I know from working with families in my clinical work in the past is that it can be a little bit intimidating to work with groups of people. When you work with one person, the work can feel a little bit more straightforward. But when you're working with multiple people in the room, there's multiple perspectives, and that can be a different thing to manage. And so through this program and through our work with families, we're just trying to help CBTP clinicians feel more confident, more comfortable, and to learn how to infuse or blend family systems, concepts, and interventions into their work. So let's talk a little bit about family systems. So you probably heard Danelle say this at the beginning, but family systems are unique emotional systems. They're groups of people who are highly connected. And in families, there's a lot of dynamics, there's a lot of things that occur. So people tend to have certain roles in the family. Sometimes those roles are based on your biological relationships. Sometimes they're based on other things. For example, there can be a scapegoat role in a family where one person is blamed for everything. There can be sort of like a caretaker role that naturally emerges among families where one person tends to take care of others. These things kind of just develop as family members kind of figure out their rhythm. It's not like somebody formally appoints these roles. But it's important as a clinician or as a provider to understand that those roles exist, or to understand the invisible rules that emerge inside of families of how families do things. Um, we also just try to train clinicians on how do you start the conversation about involving family members in the work. Different people want their family members involved at different levels, right? So you might work with a person who has psychosis who wants a lot of involvement of family members to support them. You might work with a different person who has psychosis who wants their family members to have very specific and limited roles in their treatment. There's no right or wrong way to do it. It's just that you have to understand what that person wants and what they're willing, how they're willing to integrate their family members. And then once you do get agreement to involve family members, we also have to think about how we engage those family members in the process. Different people, different agendas, different opinions and points of view. So you just have to be attuned to the fact that you're including multiple people. As part of piloting this at a local agency and as part of presenting today, we want suggestions from you on subjects or topics of interest related to family work that you're interested in. And there's some recommendations on this slide for you to think about, but there might be other things that you're encountering in your conversations with family members, and we want to hear from you and get feedback from you. But our focus really is to develop practical skills and to help clinicians feel confident in doing so. So these are some subject areas that we cover: how to engage families. Like I said, multiple people in the room, so engagement is more complicated. Also, just learning how to assess not just an individual person, but also the relationships in the family system, how closely connected or how independent people are, how much alignment there is in the goals between the person who has psychosis and different family members. Oftentimes, there can be some overlap, but there can also be some significant differences in what people want. How to provide education, right? So families often struggle to understand what psychosis is, what the symptoms are, how it's affecting their family member. And sometimes psychosis symptoms can cause that person who's suffering with psychosis to treat their family members with suspicion. And that can be very challenging for family members to understand and respond to. So just providing some basic psychoeducation about psychosis and how that impacts relationships, that's a goal. And then basic relational skills, right? We all have to talk to each other when we're in a family. We all have to solve problems together, manage stressful situations. Um, so just helping families build those skills. So here's a little teaser of an intervention that is part of our program. When we think about how to intervene with families, I want you to think of two different compartments or buckets, right? So there's what happens between people, and there's what happens within each person in a family system. And so we're going to talk today just briefly about what happens within people. Specifically, we're going to talk about cognitive processes in relationships. And standard CBTp, we talk a lot about thoughts, how thoughts influence people and how they feel and what they do. Those same things exist in family systems too. We all have thoughts about our family members, and our family members have thoughts about us. And there's a mutual influence that goes back and forth between the different members of a family system. A lot of times, a lot of those thoughts involve um, blaming statements or negative ways of framing another person's behavior, especially if we disagree with it or don't like it in some way. So there's three categories of thoughts in when we're thinking about relationships. One are attributions, one's expectations, and one's assumptions. Attributions involve just how we explain why other people are doing what they do. We all make attributions about other people, why we think they're behaving a certain way towards us. They also make attributions about us. Expectations really have to do with our predictions for what other people will do in the future. We all kind of respond to our predictions as well and behave in certain ways because of that. And then we talk a lot in CBT about the assumptions we make. In family systems, there can be a lot of assumptions too. Think about your family, right? Assumptions about what we do for the holidays, how we spend time together, who does what in the house, how problems are resolved, what's healthy, what's unhealthy, what's too much or too little contact. A lot of times these assumptions just kind of form, right? We don't sit down and have a formal meeting about it. They just occur over time as things repeat. And so how do we look more closely at these thoughts and how they affect family members? Well, we talk a lot in our general training about curious questions. And when we talk about it in our foundations class, what we're talking about is curious questions about psychosis, getting to know the person and their experiences with psychosis. We're taking that skill, individual skill, and just applying it to family systems. We want you to approach families with the same level of curiosity that you approach one individual person. And so some of these questions are just basic getting to know you questions, like who is in the family? Is it just the biological relatives? Are there other people that you consider family that are not biologically related to you? What's your perspective on the problem? This sounds like a straightforward question, but when you have multiple people in the room, you have to get to know each person's perspective. Those can be different, and you don't want to leave anybody out. How's the problem impacted the family? Have there been any changes recently? You can look at this list, but really these questions just form the basis of good, curious questioning applied to the family. And so Danelle will talk a little bit about the next steps that you can take.
Thanks, Brian. So overall, family systems work is critical in the work that we do. And it's not that scary, and we're here to support you, and give you that guidance and lay that foundation and process everything. And so we're really hoping we have people who are interested in learning more about this. So what you get, what we're hoping for some of our next steps is really that you'd start to learn this structured approach to offer family systems as a piece of the puzzle in the work that you do, to help you feel more confident and comfortable in doing this work, which we know based on years of literature since the 80s, that outcomes can improve. And we're really just hoping those who are formally CBTP trained can build on skills they already know. So we're hoping to gauge the level of interest in the group for participating in some of this. And then we want to identify a little working group to get some of your feedback, some of your great ideas, things that you'd like to see, things that are really helpful, both content and approach wise, so that we can pick your brains a bit as we, are working to develop this curriculum. And then, today, I think a little bit later, we have the perfect case review and case discussion because there's a lot of family systems as a part of that. So we'll be hearing from the centers in a little bit. So I think that's all we had today, unless anybody has any questions or feedback or wants to raise their hand that they'd be interested in helping us and being a part of this work group.